Hi guys, this is Karthik from Caapid Simplified. I may be joined by Dr. Noora, who's still in her quarantine blues. Nevertheless, we have with us a very special guest, Dr. Govind Dhawan. And probably I'll ask him to introduce himself before we go on further to explore what today's topic is.
Absolutely. Thank you, Karthik, for the introduction. Pleasure to be here with you. My name is Govind Dhawan, and I graduated with bachelor's in dental surgery in 2013. I completed my master's in health administration. Currently, I am working with the Children's Hospital of Orange County. I am working in the capacity of administrative fellow. Uh, I'll talk about more about that later, but outside my work, I love to sketch. I'm a black belt in judo, and I'm an amateur aspiring photographer as well.
Oh wow, that's plentiful and very relevant skills to dentistry, I guess.
Oh, absolutely.
One pretty interesting thing that we saw was in your email ID, it was Govind Dhawan at Chalk, which is Children's Hospital of Orange County. It's similar to chocolate. Very interesting, cool.
And our mascot is Choco Beer.
Okay.
So
That's good.
it's a fun place to work at.
Yeah, pretty good. Nice, especially with children. I think one other thing that you did not mention was your blogging interests. That was pretty much the key for us kind of collaborating with you on this video. So can you speak a little bit about your blogging interests?
I don't have specific blogging interests, but I don't know if is it something relevant to my profile?
Oh, no, fine, it's okay. We heard your
I think it's probably confusing somebody else's profile.
Okay, no problem. You're here, and let's discuss the one topic that's been on a lot of people's minds. MHA, Masters in Healthcare Administration, is a course that we see several students who are applying to DDS take up. Reasons are plenty. Few of them think it's a stepping stone. Few of them know what they're getting in for. But we believe that this video and the knowledge that you share from being a participant in the program could help them have a new perspective towards MHA. Think of that not just as a stepping stone towards DDS, but also an independent education as a good career option upgrade, and understand more about that. So this is from the eyes of a dentist, what an MHA program could be.
Absolutely. So I think you mentioned it correctly. One of the aspects of MHA is it's a good stepping stone to learn about the healthcare system here in the US and to strengthen your profile for the future DDS applications. But I also think it's more about your interests and your passion. What do you want to do? I mean, there are plenty of options after BDS. You can go into public health, you can go into health administration. For me specifically, it was more interest and passion because I really wanted to develop the business acumen and the skills, which are like the hardcore principles of an MHA program. And I don't have any background in business. I think as most of the dentists out there, I don't have a background in business. And I really, really wanted to learn about how to read a financial statement, what is cost containment. So these are the elements that I wanted to learn about. And I think that is what was the pushing factor for me to apply for an MHA over other courses. And then I think MHA is a very broad, it's a really broad perspective when we talk about a degree in specific, business in healthcare. And I think it's really a great stepping stone as well because MHA prepares you for, it makes you understand the US healthcare system as a whole, which is a very complex one because coming from India and understanding the US healthcare system is challenging because the principles are different, the core principles in India, most of the healthcare industry is based on the pay for service model, whereas here in the US, it's more about insurance based. So when I started, I didn't have any idea about what is deductible, what is insurance, what is copay. So I think this is a really good stepping stone to understand and get a step forward to apply for your next level, which is the DDS.
Okay. So maybe take the case of one patient and explain if that patient comes to a hospital in the US and gets a service and goes back, what does he see in his bill what are the different items that he might see? In simple terms, if you could explain, not without going into the details.
Well, I think the major component here in the US is a bill would contain two different aspects. The first one would be the technical fee, and the second would be the professional fee. So when I say this, the first thing is the professional fees. That means the fees that we are paying to the doctor.
Mm-hmm.
The technical fees is anything which is surrounding, which is supporting that particular clinic visit.
Mm-hmm.
So I think that makes it more, I wouldn't say complex, but it makes it more interesting as a healthcare administrator. Right now, I'm working as a hospital administrator. So it makes it more interesting, and there are so many different elements attached to one bill. It's not just patient coming in and going in, going out of the hospital system. It's the patient access center, people who are scheduling that, we have to pay them. People who are organizing the visit with the doctor, we have to pay them. We have to pay the doctor, we have to pay the nurse, we have to pay physician assistant, medical assistant. Then we have to pay people who are actually running the bills. We have to pay people who are working in finance, people who are working in coding, billing, revenue cycle. So I think it's what the patient sees is a collaboration effort of the whole team, which works behind the scenes for that particular patient.
Great. And maybe a small segue. You mentioned copay and deductible. In simple words, how can you explain what these two confusing terms are?
So deductible is something that you have to pay the insurance company before the insurance company pays you back. For example, if your deductible is $500 and you visit a doctor, you come back, you get a bill of $495. That is up to you. So you have to pay that $495. If the bill is $505, you have to pay $505 would be paid by the insurance company. Copay is something that you pay. For example, you're visiting a doctor and the fees, the copay is $25, for example. So that means when you go visit a doctor, $25 would be given out of your pocket, and rest everything would be covered by the insurance company. So this is as easy that I can explain.
Sure, that's definitely even the best explanation I've heard. Thank you for that. Let's now go back to MHA. And when you applied, or even today, if you know what the most recent is, what is kind of the eligibility criteria to apply to the program?
So eligibility criteria varies based on the university, the school that you're applying for. But I think the basic criteria remains the same. You need to have a bachelor's degree. You need to have a grade point average of 3.0 and over. If you have a GRE or GMAT, I think most of the schools, they request GRE. So a good, nice GRE score always strengthens your application. English language tests, they are mandatory all over the US. So I think that is one of the key components when you're applying for an MHA school. Another one, I think it's the letters of recommendation. So I think when you're applying, it's really important to get letters of recommendation, not from people who are high up there, but I think it's more important than people who have worked closely with you and who know you as a person. For example, when I was applying, I'm really passionate about teaching and mentoring people. So when I was working as a dentist, I was also teaching students because I felt it was needed, because the information knowledge that I've gathered over these years, it needs to be transferred. It needs to be transferred to the next generation. So when I was working, I got my letter of recommendation from the dean of my dental school. So I think that's really important to get that. The second one that I got was my associate that I was working with, my associate dentist, because that person can speak about my personality, those can speak about outside my professional experience. And the third one was my colleague in the teaching institute that I was working at. So I think having a different gamut of perspectives really interests it creates an interest in your application when you're applying to different schools. And I think that's really important to make your application more strong and stand out from as compared to other candidates.
Sure. Two follow-up questions for that. One is, you mentioned a bachelor's degree. Is it supposed to be a bachelor's degree only in healthcare, or can it be a bachelor's degree in anything?
It can be in anything. Because in my cohort, when I was in school for MHA, I had people from education background, I had people from healthcare background, I had people from financial background. So I think the beauty about the United States is you can actually pursue anything what interests you. It doesn't have to necessarily be, you need to have a healthcare degree to pursue healthcare administration. However, having said that, I think it's really important to have a healthcare experience, because when you're applying for jobs and when you're applying, when you're close to graduation, when you're applying in different positions, I think healthcare experience counts.
Okay, wonderful. Thank you for that. Um, Also, is there like a minimum that you would say is a good GRE score to apply with?
Anything above 300 should be good.
Okay.
Yeah.
That'll help.
For healthcare people, not for engineers.
Yeah, I know the entry barrier is pretty high because too many people applying. Some idea around the cost of attendance. What was it on average at your university? What have you seen generally outside?
So when I was applying for my master's in health administration, I was very strategic in applying to different schools, because my first thing was I need to go in Texas, because Texas they have a norm that if you get a scholarship above $1,000 per year, you are eligible for an institution fees. So it significantly decreases your tuition fees. So that is the first thing. The second thing is you always want to go into a school which is in close proximity to a healthcare setup or a medical center, so that you can find the opportunities to intern, network when you're in school, and learn from people who are out there in the industry. So coming specifics to the cost of the cost of attendance, I think it really varies about school to school. So for my school, I did receive a couple of scholarships from my school when I was applying, so it made me eligible for in-state tuition fees. So that decreased my education expenses like 1/3 of what an out-of-state person would pay. So I don't remember very specifics about how much is it for like a credit, but I think my whole education was about $25,000 for 3 years. That's yeah. So but you have to be proactive when you're applying for scholarships. You have to be proactive in meeting the deadlines. You have to be proactive to complete the application. What are the requisitions? You have to be very specific and strategic when you're applying for different applications for scholarship.
Great. I think
there are plenty of opportunities out there for scholarships.
Awesome. This is a great fact. I mean, it sounds very resounding for somebody to apply with that kind of a fee tag associated with it, even for engineers, because a typical University of Texas MS in Business Analytics course by itself is $25,000, but that's for a year and a half. So
wow,
this is definitely well done.
So I think another thing I would want to share would be when you're actually thinking about pursuing an MHA, always, my personal opinion would be always apply to a public school, because the standard of education given in all the schools in the US, it is like a consistent level of education. And you would always want to see if the school is accredited by CAME. That's an accrediting body which accreditates the MHA programs all across the US. So anything which is accredited, it is recognized at the national level, and applying to a public school decreases your cost of attendance.
Awesome. Does brand matter?
Brand of the school?
Yes.
It does not. I mean, I think my personal experience has been, after my master's, I decided to pursue a fellowship, and fellowship is it's a very competitive position to file for. So when I was applying for, it was not about which school are you from, but it was more about who are you. So I think, well, obviously, if you're a Harvard graduate, then it would matter. I mean, if you're an Ivy League graduate, it would matter. But I think apart from that, it doesn't matter where did you graduate from, what's your GPA. I mean, GPA is important, but it's more about who are you and what do you bring to my organization as a person. Because skills can be taught. It's more about the human skills, which is more important.
That's great. During your MHA program, outside just academic classes, what else did you get involved in to kind of improve your profile and learning?
So I think it's really important to network.
Mhm.
And always, I used to always volunteer for different opportunities, like if it was a seminar, if it was a speaking event, it was to facilitate, uh, any forum or anything like that. So I think it's really important to just put out yourself, even if you're not comfortable. It's okay. There's always a first time for everything. So I think when I was in school, I used to attend a lot of networking sessions. So I was a part of different healthcare organizations. The first one was ACHE, which is American College of Healthcare Executives. It's a really great organization. You get to meet people who are like CEOs and COOs, and you get to learn from them. Like, how did they reach their level? Like, what was their journey? What was their story? And another thing that I was really interested in, finance. I love finance. So I was in I was very engaged in Healthcare Financial Management Association, that is HFMA.
Mhm.
And it basically it's about your interest. What do you want to pursue? What do you want to do? What do you like? What do you enjoy working? So I think it's really important to get engaged in different organizations and really participate in that. Not just for your resume. Okay, I'm a part of this and this organization, but it's really important to actually go and participate in that. And I think it really helps you network, because networking is very important here in the US. So if you know somebody, you're good. So I think it's really important to get engaged and just participate in as much events as possible.
Mhm.
Uh, Apart from that, I think, yeah, I think that's pretty much it, because outside school, you don't really get a lot of time. So I think as much as you can make use of your time that is available, I think that's really important.
Awesome. I found a quote that says, "Your network is your net worth" in the US, and
I would agree to that.
several students have mentioned at different points of time that they do not know what networking is. So, if you can elaborate and like speak, one or two sentences about, what is networking, that would really help people.
Yeah. So I struggled with the same problem when I came here. I'm like, okay, what is networking? Like, people are saying network, but what is it? So I think what I have gathered over these years is networking is more about knowing a person rather than knowing a position. So you don't want to go with the intention that, hey, I need a job. No, that won't work. So you always have to, you know, you have to know a person as a human. So whenever you go out to a networking event, I'm an extremely introvert person. So it's really difficult for me to actually socialize in a gathering, but you have to push yourself. So I was reading about how introverts can network, and I came up with this acronym. It was in an article or something. It's called FORD. So whenever you meet somebody, you always talk about their family, their occupation, and R was like, I think something related to interest, and something about their dream, like what do you want to be? Even if they are like CEO or COO, what is your dream outside that? So I think it really helps attaching a human element to your personality, and people remember you. People just don't remember, okay, that guy was there or the girl was there who was asking about, do you have any opportunity in your organization? But I think it's more important that you present yourself in such a way that people remember you. So I think that is all networking is. And always ask for the business card. There is no shame in asking for business cards, and you can just politely ask, hey, do you mind sharing your business card with me? If the person is interested, they will share the business card. If not, they will politely say no.
Awesome. This is very helpful.
So just to add on that, when I was in master's in health administration, I did make up my own business cards.
Ah,
Nobody gave them to me, so I just like Google them, like, okay, if I'm going to social networking events, I need to be presentable so that I can hand over my card. So I think it was like 10-20 bucks, and I got like 500 cards. So whenever I used to go out, I used to hand out my cards. It just said my name, I'm a master's student in health administration, and this is my university, so that people have a contact to reach you out. Or maybe that's like something where people can just remember you with that card.
this is very helpful. You mentioned the acronym FORD. Can you recollect that for us once more?
It was family, occupation. Let me just look it up, because I think that was really helpful for me.
Yes. If you want to share your screen, that'll be helpful as well.
Oh yeah, absolutely.
Yeah. And one just segue at this point is R is not referral. That means on your first kind of meeting with a person, do not ask them about a referral or an opportunity. And O is an opportunity. So it's very important to first make that human connection before we go on to a transactional conversation. That is probably the most important thing that we miss out on when we network.
So it's family, occupation, recreation, and dreams.
Awesome. This is super helpful. Thank you.
Absolutely.
All right. Now let's jump from this conversation and speak about career options. Tell us, what are the different career options somebody who finished an MHA can pursue? And let's speak about that.
So as I previously mentioned, health administration is a really broad course. So it prepares you when it has the finance as a core subject, it has accounting, it has performance improvement, it has operations. So after MHA, you can actually get into any field that interests you. You can be a practice manager. You can manage a small practice. It can be a dental practice. It can be an ENT practice. It can be a neurosurgery practice. You can get into operations. That is what I'm doing right now. So operation is something, to understand operation is like the strategy would set what needs to be done and operations would execute that. Mm-hmm. So if we desire, we need to open an imaging center. So what are the elements what are needed to make it happen? So that is operations. Finance is more related to accounting. If you have an accounting degree and then you have masters in health administration, I think it really helps when you want to get into finance. You can get into IT. You can get into health information management, which relates to the data analytics. It relates to billing and coding and auditing. You can get into revenue cycle, which is, again, where the money is coming from, where the money is going, and how do we manage it. You can get into clinical operations. So there's a lot of opportunities after MHA, but I think when somebody who's graduating MHA, they don't have that scope, they don't have that knowledge. So I think it's really important to network and ask people, okay, what is that? What do you mean? What does your day-to-day look like? If you work in revenue cycle, what are the opportunities after this position? So this is my incoming position. How does it look like 5 years down the line? Like, okay, so it's important to meet people who can guide you in the right direction. And there's another fellowship. So you can apply for fellowship. Every healthcare system has a fellowship, and it's more like developing a pipeline for the leadership for the institution. So every organization offers one fellowship per year, and they have different rounds. So, but fellowship is about, you get a chance to work in different departments all across the organization. So I worked with finance, I worked with operations, I worked with revenue cycle. And eventually, by the end of the year, you should be able to identify what do you want to work in. So that is the whole concept of fellowship. Mm-hmm. And I think it's a great opportunity. I would highly recommend anyone to apply for administrative fellowships, and just don't hesitate.
Sure. During your 3-year course, at what point did you start applying for fellowships? If you can speak about that.
So it depends upon when you started your course. So I started in fall. Mm-hmm. So my ending date was in fall. Okay. And so I started applying in September, October, mm-hmm. because by March, you're offered a phone interview. And by April-ish, May, you're invited for an on-site interview if you're selected for that. And in May, June, the fellowship starts. So it's a long procedure. It's probably, you would have to invest 10, 11 months.
My God.
Because the fellowship, they ask for the statement of interest, your recommendation letters, resume, and so many different elements to it. So I think it's really, you have to be persistent and you have to align with the deadline. So I would easily say around 10 months before you graduate.
Okay, that's like another Caapid application all over again.
But it's worth.
Okay.
So, yeah, but I think timing is really important. So if you're graduating in summer, you would have to start really before that. If you're graduating in spring, so you have to strategize your application based on the timeline.
Mm-hmm. Wonderful. Sure, thanks. Okay, now let's probably drill down into the specifics of people pursuing a DDS program. For dentists pursuing a DDS program, what does MHA bring to them in terms of profile? And also, like a follow-on question is, how would they compare an MHA versus other courses like MPH and so on? So if you can speak about both of these.
I think any course after your BDS, either it's MHA or MPH, would always give you a stepping stone and would always strengthen your application. And why do I say that is because you have work experience, you are familiar with the healthcare system here in the US, and you're worked with people who are already in the US. So I think it's always a strong point. It's always a stepping stone. When it comes to comparing two different courses, I wouldn't say that MHA is better or MPH is better. That depends upon personal, a specific person's personality and their profile.
Mm-hmm.
How MHA helps in the DDS, I would say, because MHA really prepares you. It's a more holistic course that prepares you from different healthcare points. Because eventually dentistry is a business. So you need to know how to run a business. So I think from that perspective, MHA would be really meaningful, so that you can showcase that, okay, I have a business degree and I have a dental degree. So when I start my practice, this is going to be really important to me. So this is how I can add to my profile. And second thing, I think MHA also helps you identify your leadership skills. So if you want to be a leader in the future, getting your DDS and then you have MHA and you want to run a department. So I think here as well, your MHA would be of significance, importance, and really it'll add value to your profile.
That's awesome. That's some very good points. First is the holistic nature. Second is, unlike other healthcare professions, a good number of dentists actually end up running a private practice. So there's a huge component of entrepreneurship, which MHA kind of nurtures, understanding of health system. Second is, if somebody wants to pursue a hospital-based dentistry in the future, either as a department or as an academician, and MHA will give them the kind of skills to get called for an interview and then actually secure that job. Some great points. What if you change the order of things and somebody applies for an MHA after DDS? Do you have any thoughts on that?
I think it would, again, I would circle back to, it's really important to build the skills that you don't have. So applying to an MHA after DDS would actually help you build the skills which would be needed to run a practice. Again, it really depends upon what's your dream is. What do you want to achieve? What are you passionate about? If you really want to get into a business side of the dentistry, maybe in a healthcare setup or any other organization, yes, MHA is really important. Because for the executive levels, I think a clinical degree with a business degree, it's like an amazing combination. So I think there is no harm in applying for an MHA course if you really want to do it, if you're really passionate about it, because it's going to increase your credibility, it's going to increase your skills, and it's going to add value to your profile. So absolutely go for it.
That's amazing. I think in a cost perspective, it definitely makes sense because an MHA program is 1/5 the cost of a DDS program. In a time perspective, people might evaluate it because it's 2 + 3 years, 5 years. But coming from the pharma industry, I've seen key opinion leaders typically have the balance of both of these degrees in some order. So the ROI that you might get with the combination of both these programs in any order is humongous. And probably that's where Govind is coming from when he says, you must have a higher dream to achieve. It could also make financial sense, quite literally. This is terrific. Probably just one last question for a BDS student, who's competent and competitive, who comes to the US, pursues an MHA. What would you say is like an average pay package that they might receive?
So a recent MHA student, it really depends upon where, it is very contingent upon where you are in the country. So if, for example, in California, if you're a fresh graduate, expect something between 75K to 105K, 110K, depending upon your profile, depending upon your experience. If you're in Texas, it depends upon which sector are you working from. So if you're working in operations or either in finance, you would pay higher because that is like a backbone of the healthcare organization. If you're working as a practice manager, probably a little lesser because you're a fresh graduate and you don't have that much experience and expertise. If you're working in IT as an analyst or something, probably a little higher. So it really depends upon which specific sector of healthcare are you working in. But I think more or less you should expect between 75 to 105, 110K in California. You have to, geo adjust that to different locations in the US.
Sure. Thank you. Even despite the variability, our viewers love to hear a number. It just gives them some a sense of confidence when they apply for the course. So it definitely makes good ROI sense for an MHA program, especially coupled with the TDS. In closing, do you have any words for dentists applying to MHA? Do you want to share some final thoughts?
I think the only thing I would say is always pursue your passion. So if you're really interested in MHA, go for it. There is no harm because you're going to build new skills, you're going to learn something new, and it's always going to add something to your profile.
Sure.
And good luck.
Thank you, guys. We might add the profile of Dr. Govind if he's interested on our description, along with the very interesting model he spoke about for networking, which is the Ford model. And we also have a follow-up video coming through, which explains a little bit of the nuances of what healthcare insurance is in the US. Basically, talking points for you to cover that if it appears in your interviews. Having said all of that, thank you so much, Govind, for joining us. You're the first.
Pleasure is all mine, Karthik. Thank you for having me.
Yeah. Have a good day.